Bonjour, welcome. We are with our Italian speaker. First of all, thanks to be here and to come from Florence. Our question is, what are your main indications of off-label use of PDL in 2016 in Italy?
So the PDL is a vascular laser, so the target is hemoglobin, and the off-label indication are all inflammatory or preneoplastic and neoplastic diseases with a great or a big vascular component. So some example could be post-surgical scar, post-traumatic scars, keloids, or viral bursts, and inflammatory diseases as acne and diarrheal disease, or neoplastic as Kaposi sarcoma or Jensen-Kanov disease. And we can use in monotherapy the PDL, or in combination with CO2 laser with a fractional or ablative mode.
Okay, we are going to go deeper in some indications, but before we are also with the president of the European Society of Laser and Device. And Hans, have you any other indications with your PDL?
Sure, thank you, Anne, for your kind introduction. Also, I would like you to thank you especially to actually host ESLD here at the ADES, at your meeting that you have been organizing so perfectly. And we had a very good session this morning. We talked about some of the indications that you can use your pulse dye laser for. I think there's so many medical indications that pulse dye laser is a good tool. Also, it's good actually to get your practice in a medical term to actually have a better patient binding. We with ESLD are having, for example, one of these public awareness campaigns now running till the October 2017, where we actually make people aware of these medical indications. Specifically, one is actually the chronic radiation dermatitis that affects quite a large number of patients, and that most people are unaware of, especially the physicians who are treating those patients are unaware of that. It's oncologists who have no connection with the laser medicine world. So it's an indication that actually hits about 1/3 of the women about 10 years after their radiotherapy, and it's a quite huge number. Looking at this disease that is a chronic disease, and disfigures the area that has been treated with radiotherapy. It saved lives, but at the same time, it actually reduces quality of life in the long term. So those are these vascular lesions induced by radiotherapy can easily be treated with pulsed laser. Also with other lasers like the Nd YAG, with KTP, even with flash lamps, it might be a very good treatment. And I think we need to raise awareness of those. And as you said as well, this surgical scars, post-surgical scars, we now have tools in the 21st century where we can improve medicine. And we should use them. Not only should we use them, we should make people aware of them. And that's where we hope with ESLD, and also with the help of all the different laser groups from Europe, like the French laser group, like the Tunisian laser group, and also the Belgian laser group, that we advance medicine to the 21st century.
Thank you, Hans. Yes, dermatitis is really a kind indication of PDL. And for scars, should you be so kind to tell us your current and precise algorithms with the combined treatment PDL and also fractional CO2 you are using?
Yes, for post-surgical or post-traumatic scars, nor keloid or hypertrophic scars, we use the combination of fractional CO2 laser and dye laser. If the lesion is very vascularized, at first line we use dye laser in monotherapy. And after 60 days, the combination of fractional CO2 laser and dye laser. We can repeat this protocol for 2 or 3 times. At least. And instead for keloids or hypertrophic scars, we use the ablative CO2 laser in combination with dye laser. If the lesions are very vascularized, we use dye laser at first treatment, and after 6 days, combination of ablative CO2 laser and dye laser intralesional. And we are achieving a great result in keloids of herring or spontaneous keloids of back.
Thank you. And I am really impressed during your presentations with the tools you are using to assess your results, the before, after, with like not chromometer, but other tools. Should you be explain us what exactly is these tools?
We perform digital photo, polarized or not polarized, with a source called Ontology. It's digital photos, and for the multispectral imaging, we use Antera 3D. And with this imaging, we can detect pigment and vascularize, but also the wrinkler, or detect the texture, and even the 3D photos. So this is really great with laser practice, because you can see the little change in a wrinkle or texture, pigment, or vascularization.
Yes, and for your second talk on melasma, we saw the importance to use digital and polarized photo. You can see if it's a pigment types or melasma with a lot of vascular lesions. Should you explain us for melasma? What are your algorithm again?
Yes, for melasma, we consider the epidermal type with the brown colored, and could be vascularized or not vascularized. So in case of vascularization, we use just the IPL, intense pulse light, and when they are vascularized, the red light IPL. In case of deeper melasmas, mixed or dermal type, we always take in consideration vascularization, and usually we combine the light with laser. That could be Q-switch laser, neodymium YAG Q-switch, or fractional CO2 laser.
Okay. Have you a question to Diletta, Hans?
I actually, yeah, it's interesting for me. It's this new concept of treatment combination that is coming up, I think, now since 5 years. More and more we're realizing that one light source is not enough, that we should maybe combine different light sources for different for the same indication. And I really love this approach of using the pulse dye laser for treating melasma, because it's not so obvious to us, to the naked eye of the observer, to treat those pigmentary lesions at first sight with a vascular laser. And I think Thierry Passeron, he did an excellent job in Nice, looking deeper into that, and also publishing several articles already about the use of pulse dye laser in treating melasma. And for me, it's really, I think, important to know a little bit more about the settings that you're using, so we can actually exchange and we can improve our practice. So what is your setting that you use for the pulse dye laser in treating melasmas? Do you have a standard setting? How do you change those settings?
Usually we have a standard setting with a 7 joule and short pulse duration, 0.5 millisecond.
And it's 12 millimeter spot size, if I understand.
12 millimeter spot size, yes.
And do you change it if you see it's more vascular, or do you change it, go you up with the energy? Do you go down with the energy? Do you change pulse duration?
Yes, maybe we can change the pulse energy, but not the pulse duration. It depends on the vascularization, or the phototype, or the kind of scars.
But with this type of settings, you got purpura.
Yes.
To your patient, yes, and it's not difficult.
It's difficult, and we have to explain before treatment the patient. In fact, in many cases, we consider the red light technology instead of PDL, because some patients don't like the purpuric lesions.
I think that the team of Professor Passeron in France are using longer pulse duration, 6 or 10 milliseconds, with a 10 mm spot size and 6 joule. Perhaps you can exchange settings.
I think they're using definitely non-purpuric settings. They
Yes.
increase the pulse duration, getting into a non-purpuric setting, and I think they also have good results. So maybe we can get there
Yeah.
to something where we could
But
have
this
actually.
is interesting.
Are they as good? It's the
Yes.
question. I mean, that's really the question. And I think that's where we need to exchange more and see what is really the best setting. And I think that's where we
Yes.
sitting here. It's one of the important things to talk about is actually what are the parameters we're using.
Yes, we're
And
working on it.
you need one session or several sessions if you use purpura settings to treat the vascular component of melasma.
Generally, just one session.
Yes,
is enough.
just one session. In the study of Professor Passeron, there is 3 or 4 sessions. It's always the same, like with erythrosis, rosacea, and PDL, with purpuric settings.
That's the thing, but I think it's a patient choice after.
Yes, yes,
I
yes.
think that's what we
Yes.
need to have. We need to have good treatment algorithms that actually work, and we know that they work well. And then afterwards, when it's every patient is different, and we need to talk to the patient. How is your social life? Can you actually afford to stay at home for 2 weeks? I have some translators in Strasbourg from the European community, so they're sitting in front of the computer all day. It doesn't bother them at all to actually be 2 weeks at home and not go out. But then other people have a very active social life, going out every night. They can't do this. Or to be representable at work, you can't get away with purpuric settings, and they have to take vacation if you use. Right?
Yes, you share with us a lot of clinical cases on viral warts, on Gessner-Canov, on verrucosa plana and it was very, very interesting, and also on Darrier disease. Should you be so kind to
Sure. We recently published an article about a case series of Darrier disease with a great result after just at least 2 sessions. And we used the fractional CO2 laser and dye laser at the same session. First the fractional and then dye laser intraoperative.
Okay, and what about your settings?
The fractional in 13, 14
millijoule per mtz?
Yes, power, and 500 spots distance.
Okay, space dot.
Yeah, space dot. Sorry.
500.
And 7 joule PDL.
Okay.
And long pulse of millisecond long pulse.
For me, it's a question to begin with PDL or to begin with fractional. With fractional, perhaps the light is an obstacle to the PDL to work. No.
Yeah.
The question is perhaps if I try to do the same combination, I prefer to begin with the PDL and after the fractional CO2.
Why?
Why? Because I after my fractional laser, I saw white spot.
Okay. Yes, but if you use fractional, is good to create more vascularization for the dye laser.
Okay.
So if you use,
it enhances the target.
You have to use before fractional to better work with dye laser.
Okay.
Because it's attract to the vascularization.
But in the
I
same
see a clinical trial coming up there. It's very interesting. You should actually make 2 sides, split a scar, and just switch them around and see what is more effective. You have a good point, and you have a good point as well. I mean, you increase the vasculature, but you decrease the penetration with the whitening of the CO2 laser. Then you could actually enhance it. Just applying some glycerin cream or any ointment will help to actually get rid of this whitening. But I think I would do it intuitively. I would do it as you, but it's very difficult to actually judge just from that feeling.
But really, thank you for a very interesting cases in clinical dermatology, because in the French laser group and in the ADES in Marseille, we are very proud to use our lasers and also botulinum toxin or fillers to help patients in dermatology field, and it's really a good
also
talk.
In
and
inflammatory, common inflammatory diseases. Psoriasis or
yes, the case of psoriasis guttata is very interesting too. I never saw that before.
And we are treating some porokeratosis patient. We haven't yet result, but we are trying to work on it. Both with the PDL or even fractional PDL, the same patient.
My personal experience with porokeratosis is non-ablative fractional, works very well, and it's like a charm, and patients are very happy.
Thank you very much, Hans, to help her and to agree for the course, ESLD course in Marseille. It was a great honor to have the president of the ESLD. And again, thank you, Diletta, for the Italian experience. It was very, very interesting. And I think a lot of French dermatologists will have a new idea and very, very interesting things to bring in their pocket, in their office. Thank you very much.
My pleasure.
Okay, and for all of French dermatologists, you can have all the PowerPoint and all the abstract of the sessions of the ADS, ESLD course, and all the course in Marseille in e-book version on the website. So go there and learn. Thank you all.